mynews.studio.
Picture a rural village in Congo. Just recently, it was overshadowed by fear. Now, health workers are gathering there to announce the end of Ebola. So, what made things turn around this time?
And to note the date, today is 2025-12/09. The Democratic Republic of Congo has officially declared its latest Ebola outbreak over. But this isn't just a regional headline, is it? It feels like a significant moment for global health.
It really is a milestone. If you look back over the past decade, Congo has faced Ebola several times. What set this response apart was how quickly and in sync everyone worked. They managed to contain the outbreak much faster than before. But why was that?
It comes down to strategy. They used what's called a ring vaccination approach, vaccinating those most at risk, like health workers and people who'd been in close contact with cases. Over 47,000 people received the vaccine. That's no small feat, especially given how remote some of these villages are.
Community engagement was crucial too. Health workers collaborated with local leaders and volunteers, making sure to speak local languages and address people's concerns directly. That helped dispel rumors and got people on board with contact tracing and movement limits. In previous outbreaks, misinformation created a lot of resistance, even violence. This time, it was different.
Quick question. Do you think local volunteers really made such a big impact?
Absolutely. When information comes from someone you know, it doesn't feel distant or imposed. That trust meant people got vaccinated early, followed restrictions, and were more open to seeking care. It closed the gap between health officials and the community.
Meanwhile, Ebola wasn't the only concern. Other health services had to keep running. How did they balance that?
That was a real challenge. During outbreaks, resources often get pulled toward the crisis. Services like maternal care or routine immunization can get sidelined. So, they set up dedicated Ebola treatment centers, while other clinics kept handling regular care, but with strict infection controls.
Were people scared to go to hospitals?
Yes, especially early on. There was real anxiety about catching Ebola at clinics. Separating Ebola care from other services and boosting infection control helped calm those fears. Still, the health system was stretched thin. And remember, Congo was facing other issues too, like Mpox and cholera. It's a reminder, outbreak response can't come at the expense of routine healthcare.
So even with the success, there are still weak points. What's the biggest risk now for Congo?
Infrastructure is still fragile. There's a heavy reliance on external support. Even with all the lessons learned, another outbreak could put pressure on the system. If several emergencies happen at once, it's hard to keep up. Sustaining progress means continued investment and being able to respond quickly when new cases appear.
So the risk of Ebola hasn't disappeared?
No, Ebola hasn't vanished. The virus is still present in the environment. The difference now is that there are better systems in place for a faster, more effective response. But it all depends on staying prepared, support, research, and constant vigilance.
And why should people outside Congo care about this story?
Because it demonstrates that even the deadliest epidemics can be brought under control with coordinated action, effective tools like vaccines, and real engagement from communities. After COVID-19, everyone's more aware of the importance of readiness. Congo's response is an example for tackling future health crises, even in tough conditions.
So in the end, strong strategies and local involvement can turn the tide, even in the hardest situations.
Exactly. It's about building trust, relying on good science, and making sure systems hold up when they're under pressure.
And that takes us back to where we started, a village that's moved from crisis to celebration. The outbreak has ended, but the larger story continues.
Thanks for joining us as we looked at Congo's Ebola response and its significance for the wider world.
Thank you for listening. This episode was brought to you by mynews.studio. Give it a try for free.